In the studio for our Your Health segment tonight are Dr. Habiba Park, Associate Professor at the University of Maryland School of Medicine and Critical Care Surgeon at the R. Adams Cowley Shock Trauma Center, and Dr. Sharon Henry, the Ann Scalea Professor of Trauma Surgery and Director of Wound Healing at Shock Trauma. Thanks to both of you for being with us.
Thanks for having us.
So I was thinking there have been two major developments in terms of saving lives over my lifetime. The advent of CPR training for civilians and what was pioneered at your institution, Shock Trauma, the Critical Care Trauma Center. What you're working on now is really a third major program called Stop the Bleed. What's the purpose of it?
Stop the Bleed is exactly what it sounds like. When people get injured and they begin to bleed, they can die before help arrives. And what we are trying to do is empower people who are there on the scene, the people who are bystanders, to jump in and start to help before help actually arrives.
At Shock Trauma, you see a lot of gunshot cases. Is that all exclusively what we're talking about?
No, I think that's one of the things that make this so adaptable to so many situations, is that it was initially created from the Sandy Hook massacre. But the skills that we teach are applicable to any situation where bleeding is a problem, where we think that there's life-threatening bleeding. So that could be a car accident, it could be a construction incident, car accidents being one of the major, also one of the other big major causes of injury and death. I actually keep a kid in my car. Home incidents, cooking incidents, so you name it. If there's any situation where potential bleeding could be a problem, you can use these skills.
How does a bystander who's not a trained paramedic know if it's critical, life-threatening bleeding?
Bleeding that accumulates. So if you see a puddle forming, you see a large quantity of blood, that tells you it's major. Or if it's spurting, if you see blood spurting up out of a wound, that's a major wound. Sometimes you can tell because the person isn't responsive, because they're going into shock and they're not awake and aware and they're not talking to you. Those are all signs that there's serious bleeding.
How fast do you have to move? How much time do you have in these situations?
You can have minutes. I mean, you can bleed out in 5 minutes from a bad arterial bleed.
And you see it at Shock Trauma, where people get to you really fast, but not fast enough.
We see it, that happens. And when people arrive to the trauma center alive and with vital signs, we have a much better shot at saving their lives than when they come in without vital signs.
This is it's a 1-hour course. We're going to give everybody the 3-minute demo, but before we do that, let me ask the question that I bet everybody's thinking about, which is, with blood, there's sort of the ick factor and there's the HIV factor. That unless you happen to be carrying surgical gloves around, people would be really reluctant to dive into that pool of blood. How do you answer that?
Yeah, so that's a really good question. So sometimes we have the commercially made kits that come with gloves, because obviously our number one goal is to promote an environment of safety. We never ask anybody to put themselves into harm's way. Always assess the situation and make sure that it's safe. And it's really up to that person's judgment. If they want to put themselves at risk of exposure to potential bloodborne diseases, then that's really, you're weighing that against the risk of potentially losing someone's life. I've heard people even try basic things like trying plastic bags over their hands if they have them available. Gloves obviously are the better way to go. Always wash your hands afterwards to remove any risk of exposure, and call 911 or get help if you do have an actual exposure to an open wound with blood.
Okay, so what we're about to do is going to be like the 3-minute version of a CPR course, which is not good for a whole lot, but maybe good for something. And we encourage people to take the full 1-hour course, and we can talk about it. So you brought with you this plastic, oddly shaped body part.
Yes.
with
a
bad wound.
Yeah, this is the model that we use to help teach the course, and it has a variety of types of wounds. This is more like a puncture wound, and then it has more of sort of a laceration, and then another sort of puncture wound. And it teaches several things. We always start with the first thing you do to help control bleeding is pressure. You have to push hard And one of the things that people are always surprised about is how hard you have to push to be able to stop bleeding. So you have to put your body weight into it, lean into it.
Is it going to stop, or are you pushing until the paramedics get there?
You want the blood to stop. If the bleeding doesn't stop, then you have to escalate your maneuvers, meaning
Okay.
you'll go on to try another maneuver, which may be packing. And what we brought here is a commercial gauze that is impregnated with material to help blood clot. And you can use this or a plain gauze. If you don't have either of those, you can use material. You can use your shirt. You can use anything.
Whatever you got.
Whatever you got available. And the idea is you want to get the packing material down to the base of the wound. So the bleeding's not going to stop if you just put it on top. You got to get all the way down to the bottom and pack in as much as you can get in to tamponade. Essentially, what you're going to do is plug the dike. You're going to be the Dutch boy with your finger in the dike, making the bleeding stop.
And so we're not worried whether it's sterile or not at this point.
No, at this point you're saving a life. So
Right.
you worry about infection later, so absolutely not.
And we're going to talk about a tourniquet, but
Yep.
does elevation help?
Elevation helps.
If it's a limb or something,
If
and
it's
you
a limb, you
get-
can elevate the limb. That will decrease the amount of blood that's flowing to that area. So yes, absolutely, elevation will help.
Okay, pros and cons of putting a tourniquet on. How do you decide?
Yeah, well, there are a couple of things to remember about a tourniquet. It can help and it can hurt. The thing people worry about the most is causing an amputation. You're cutting the blood supply off to the area, and if the blood supply is cut off for too long, that can result in ischemia, which is loss of blood flow, and can result in an amputation. The other thing that can happen is you put it on too loose, and it doesn't do the job it's supposed to do, or it increases venous bleeding. So one of the things that surprises everybody who takes this course is how tight that has to be to stop arterial blood flow. Everybody's had their blood drawn, and you know what a venous tourniquet feels like when you get your blood
Sure.
drawn. That hurts, right?
Yeah.
This hurts more because it's tighter.
Okay, so that goes over the plastic.
So you want to put this above the area of injury. So let's say
So between the heart, you know where the heart is, the
Correct.
bleeding's
So
here,
if
it's
this
got to
is
go
the
in the middle.
injury
Right.
you're trying to control, and this is where the heart is,
Right.
and the legs are this way, has to go above.
Right, so you want to put at least a couple of inches above the site of injury. This sort of is one size fits all, military grade tourniquet, because these are the ones that research has proven to be effective. You cinch it down as tight as it'll go. Then you tighten the rod until you have control of bleeding. So you should be able to see the bleeding stop. And then you're able to wrap the Velcro around all the way, fasten it into place. And then a lot of these will come with a time mark on it because we like to know how long the tourniquet's been on. We try to keep it within a 2-hour time frame.
So in real life, no civilian's going to have one of those, but it used to be cloth and a stick. Does that work?
Go ahead.
So actually, studies have been done comparing improvised tourniquets to military grade ones, and there's a lot of issues with using improvised ones that could potentially lead to more loss of blood, and potentially loss of life, creating it. Issues with tightness and keeping it a consistent tightness that bleeding stays controlled. A lot of times you'll lose that. So oftentimes we found that bleeding continues as opposed to stopping.
Okay, before we run out of time, people who feel like they ought to get trained, how can they get more information?
Go to our website, which is mdcot.com, and we have the courses listed on there. You can also go to bleedingcontrol.org, which is a national website to also find courses as well.
Doctors, thank you very much.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.